Brand new treatment, a one-time treatment we have for cellulite to get you ready for summer. So let's talk about what cellulite is. What causes it?
Yeah, so great question. I think there are so many people have it, even before like us talking about it. There's so many women out there, and even men, that get cellulite as they get older, right? Because they lose volume around the bands that attach the skin to the actual tissue underneath there, and they cause these dimples. And those dimples end up looking, a certain way, and they make us look a little bit older in different areas that we get them, right? Most common places you think that women see cellulite or what?
Definitely the eyes and booty for sure. I think pretty much all of us have it. Probably like 90% of women have cellulite in those areas.
Absolutely, right? So I think it's one of those things that you want to identify. Well, is there a way that you can actually figure this out at home without having to get a consultation, without going through all the huff and puff of going to a clinic, this and that? What do you think?
Yeah, definitely. So if you think you might be a good candidate for cellulite treatment, we want to see if it is true cellulite, if it's caused by those bands that are connecting the tissue to the skin above it. So what you can do at home to see if it might just be skin laxity or if it is true dimpling, pull upward on the skin, make your skin taut, and if those dimples disappear, it might just be a skin laxity issue. And then we would have you come in for a consultation. We can talk about, other skin tightening options or surgical procedures to get rid of that excess skin laxity. But if it is true dimpling, you might be a great candidate for this treatment.
Yep, and so this treatment is Aveli, right? And so Aveli is this brand new device that's been out in the market for, a good period of time now, over a year or so. And what it does is it allows us to hook those little bit bands and pull them out right where that dimpling is happening. So just like Meredith explained, of seeing those dimples at home, when you pull the skin laxity up, that means you're spreading that skin, making it nice and tight, and then finding exactly where that band is holding up. That's the one we actually just cut. Leave everything else attached so we're not disturbing anything or causing any more skin issues, right, to release it. And then that dimpling is gone.
Right. So one and done treatment, is this something you would ever have to repeat again in the future, or?
Yeah, so it's a one and done in that area, right? Now, if you get cellulite in different areas, it's not going to treat those things, so we never treat them to start with. So that's something you just have to take into consideration. Now, there are certain people that are not good candidates for this. Do you want to talk about some of them?
Yeah, so like I mentioned, if there is excess skin laxity in the area or if it's not true dimpling, patients who have lost a massive amount of weight, like I said, we might be looking more towards surgical removal of that excess skin. So also we would prefer, if you're planning to do this awake, we can definitely do it under local anesthesia, for patients who don't have anxiety or things like that. But we do also have the option of doing it under general anesthesia, so we make sure you're calm and comfortable throughout the whole thing. Let's talk about pairing it with body tight.
Yeah, no, great question, right? So when we're going in there and releasing these bands that are holding that skin down, kind of like a button on a couch or something like that, and we're releasing that area, we also want that skin not to just puff out or create a crease or anything like that. So that's where this body tight can come in place, and it can help tighten all the skin around the entire area to soak it up, to leave it tight like you would when you spread out the skin on your thigh or your butt or the different area that you have any of the cellulite. Now, doing that in conjunction, that's what allows it to work. And I think it's great that you brought up the massive weight loss patient population. Those folks have lost so much weight, they have also extra skin. And that's where it's not going to work as well in terms of body type or just with the cellulite removal. It needs a combination of things, right? It might still need cellulite removal, but it also might need some surgery that removes the actual extra skin to make it tight, and then if any dimpling exists after that.
Right. All right. Let's talk about timeline. So summer's coming up. When do patients see results from these treatments, especially when we're combining it with the body type?
Yeah, so if you combine the Aveli with the body type, Aveli is going to be instantaneous, right? You're going to release that dimpling. You're going to see a smoothing of the area. You might see some puffiness from the local medications that we put in there that lasts about 3 to 5 days, but that part's pretty much done. From the body type standpoint, it's going to tighten some of that skin immediately. It's going to feel a little firm to start with. It's going to get another series of tightening that it does on its own at 6 weeks, and then again at 6 months. So at 6 months, you'll see the ideal result for all the skin that gets tight, along with the removal of those dimples.
Awesome. But if I have a vacation coming up, like in June, I would be seeing results already from this.
Absolutely. And I think the dimpling is going to go away. It's about that tightness of the skin that's going to continue to improve. So immediately the cellulite part's going to get resolved, But the combination of the Biotech with the Aveli, that's where you get these massive changes, and it kind of pretty much turns back to the hands of time for that area.
Awesome. Let's talk about recovery. So if I want to do this like on a Friday, when would I be able to go back to work?
Yeah, so if you want to do it on a Friday, you can easily go back to work on that Monday, right? You can take a couple of days off. Pretty much you have to wear a garment to get the contour and that shape. But other than that, we want you living the rest of your life, right? In this, it's a minimally invasive procedure, which means that there's not much downtime or anything like that that's associated with this. If we have bruising or anything like that, which you have slight bruising just from removing those different bands that are attaching things, but that usually gets taken care of with our post-operative arnica treatments.
Let's talk about what minimally invasive entails.
Yeah, and so these things in terms of being minimally invasive, it's just a small nick in the skin and then putting in the device through that area to then release just the dimpled area. It's not this big long scar or anything like that. So it is truly a small little, less than the width of my pinky, right? Of these little points. And again, like you mentioned, like this can be done awake. It can be done also asleep under general anesthesia, right? The key is comfort for actually getting this done. And then how many areas of cellulite we're treating. Doing it awake in terms of a lot of areas ends up taking a lot longer versus being asleep, and therefore getting through the procedure in a safe manner and addressing all the different areas that you have.
All right, awesome. Do we have any questions?
You know we do, Meredith. So our first question is from Gabby. She was asking, can Aveli or Aveli be combined with other procedures like liposuction or BBL?
Yeah, and so that's an awesome question. It definitely can, right? And so sometimes we'll split up the two treatments. We'll initially start with the Aveli, and that can be awake in the office, and then come in for the BBL where we liposuction everything out, put the volume in there. Now we release all those bands so you can clearly fill in that space to give a nice smooth contour for the entire area.
So that could even improve the results of the BBL as well.
It definitely can improve the results of the BBL for sure.
Awesome. Carol was asking, she said that she's had cellulite since she was a teenager. Does that change anything as far as candidacy?
Yeah, so the timeline of when you have it is not as big of a deal as assessing the whole thing like what Meredith talked about. If you stretch out the skin and it goes away, that's a skin laxity problem, and that's not really cellulite. And skin laxity, it's that term is thrown around, right? But in common terms, it's stretchy skin, right? And there's only a certain amount of stretchy skin that can tighten, especially like women understand this with pregnancy in that part of how the stomach can come back together and it can come all the way, or it can stay loose in terms of that tissue. If it does stay loose, that's where that's more surgical versus something that's Aveli or non-surgical related in terms of getting that skin to be taut.
Awesome. Somebody was asking, how does it actually release those bands? Does my skin get cut or what happens?
So not the skin, but the actual band that is connecting it to the tissues underneath. That's what we're cutting, we're releasing. So those fibrous bands will never grow back, which is what makes it more of like a one and done type of treatment, as opposed to some of these other things that might tighten the skin on the surface or kind of minimize the appearance, but it's not really addressing the cause of the dimpling in the first place.
Yeah, with the way that the Aveli is set up, it's like a small thin rod that has a little scissor at the end, but it's protected. So it has a little gun device that ends up allowing it to open when we want to, hook onto that little tissue, and then releasing that area. So that way you're only addressing that area. We're leaving the rest of the blood supply in place. We're leaving all the other connective fibers that are causing everything to stay tighter in place, right? That's where the Biotech can help those also be tighter, along with removing the ones that are causing the dimpling.
Awesome. Melanie had asked, can I do Aveli if I'm planning on losing weight?
Yeah, and so that's a great question, right? And again, it comes back to the Meredith's test to say, hey, if it's taut and you're going to have that dimple, that's going to be there whether or not you lose weight or not, right? It actually might even get worse because you're losing the volume around that dimple and that tight fibrous band. So whether you do it before or after, it really is up to you. And then it comes down to what is the ultimate goal? And I think that's the bigger question, Meredith, right? When we see patients, we want to know, what's the final time point? Because we want everything to happen in the least amount of procedures to actually live your best life, and that you're not having to do any of these things again.
Right, and like you said, with the skin tightening as well, that's going to keep getting better over time. Your body's going to continue to tighten that area, so lasting 6 months or longer where that tightening effect is getting better.
Yeah, absolutely. And I think it really kind of is, where does it fit your life in terms of the downtime?
Mm-hmm.
This is one of those few procedures that we have like very little downtime, but a huge result right off the bat.
Awesome. Carlos had asked, how does this treatment compare to topical creams or injections that help with cellulite?
Ooh, great question, right? And so the topical and the injection. So topical creams, I think that they have been in the space, and keeping it real for this is like they've never really worked as well. They just have promised a result that they can't. They haven't been able to deliver in terms of what people actually want. Because if it's a band that's underneath there, how is a topical really going to solve that?
When you think about the anatomy, that doesn't really make sense. It might improve like the appearance of the skin turgor on the surface, but not really addressing the root cause of that cellulite dimple.
And then the injections, right? So there's this, I think it was called Quo or something, where they were doing these injections, but there was no control over how or where the material went. So you could address the actual dimple, but then they would address the entire area around it. People would get these massive bruises in terms of releasing the cellulite. So for some people it would work, and then other people, if it went and diluted to other places, it didn't really work, and it loosened the tissue a lot more, and you didn't have a great result, and you ended up with a bigger problem. So this was the best of both worlds in terms of getting to exactly where the dimple is with the least amount of interruption of any other tissue around there, and then being able to tighten all that tissue around there. It's like, I think this is the least invasive thing that we have that will remove cellulite for good.
Awesome. Patricia was asking, is there a certain body type that this works best on?
A certain body type. What do you think?
I would say probably the closer to your goal weight, the better. Besides that, there's not really like a cutoff or like a body fat percentage or anything that you have to be, but the closer the better, I would say.
Yeah, I think it comes down to a dimple is a dimple is a dimple,
yeah.
Right? So if there's a dimple, regardless of the body shape, the size, even the weight, and stuff, that dimple, if it doesn't go away when you stretch out the skin, it's going to be there, and that's going to be there regardless if you fluctuate weight, whatever the end goals are, all that stuff. So if it's if you want to be dimple free, that's what the Aveli is for.
Cool. Bella was asking if she needs to do lymphatic massages after the treatment.
Right. So lymphatic massages usually help with any of the swelling that you're going to get in that area. In this area, we're really just putting some numbing and numbing medications in those areas. So you're not really needing any to like rerouting of lymphatics or anything like that. So I think lymphatic massage is an overkill.
Optional.
Yeah, I think it's an overkill for this area and what you're trying to treat, because the compression is probably a bigger deal than the lymphatic massage.
Like you said, it's so precise. We're not causing damage to the entire area. We're just snipping those bands where the dimples are at.
Right. So it's completely different in terms of when we do liposuction and we're creating all these different tunnels in these different places and we're suctioning things out, where you might disrupt some lymphatics and you just don't know and you're not aware of them. And that's where those lymphatic massages can help take that down and get you a better result. For this, we're staying a lot more superficial, closer to the skin. We're not disrupting any of those lymphatics. A great question.
Awesome. Carol just joined the live and she was asking if she can tan or use self-tanner after the treatment.
Okay, self-tanner, right? And so how many days do you think that, we talk about downtime being about 24, 48 hours or so, and then we have these little nicks in the skin. So when do you think it's safe to self-tan with nicks in the skin?
Depends if you'd be going right over those little incisions made, but if you want to avoid those, you could do it same day if you wanted to. There's no contraindication to using that topically on the surface of the skin because we're not disrupting that skin barrier on the surface. Like we said, it's just a little incision. If you want to go around that and go for your self-tanner, go for it.
Right, but then so when do we think in terms of timeline would self-tanner be safe? Like how many weeks after somebody has a procedure?
Like a couple weeks as soon as it's closed up, maybe like 1 or 2 weeks after it should be closed over, you should be good to go.
Yeah, probably the 1 to 2 week timeline sounds right in terms of appropriateness. The skin really epithelializes itself within 24, 48 hours, right? So anything after that is usually going to be pretty good. I think a week is probably on the safe side of things.
Cool. Bree said that she has a big wedding in July, and she wants to know when she needs to do this treatment to see results.
Yeah, and so I think ideally the sooner you do them, the better results you're going to get, because from the body type part, you're going to get that first shrinkage at the time of surgery, another one at 6 weeks, and then another one at 6 months. 6 months from now is way past that wedding date, but those first 2 shrinkages you can definitely get from that 6 week time point if you work those days backwards. And so I think the sooner the better.
Awesome. We got another great question from Carol. She wants to know, are the effects long lasting?
Yeah. I think Meredith, you want to take that one?
Yeah, this is a one and done treatment. So once we snip those fibrous bands that are connecting the skin to the tissues below, those never grow back. So this is a one and done.
Yep. For the cellulite part, it's one and done. For the skin laxity piece, that really depends, right, in terms of how good we maintain our results, what we do afterwards, right? In this, it's not like we're excising any skin because we're just doing body tight. And when we do the body tight, those results, depend on, hey, what our jobs are, how much, what areas we're trying to affect, how much skin we're working with in terms of tightness in the other areas, and say what the longevity of that is.
The health of the skin when we're starting, future weight loss, all those things can affect that skin.
And nutrition, right? That's the thing that we talk about a lot in terms of getting the best results is the better nutrition you have before, the better you will do after.
Awesome. Bijal just asked, what's the difference between cellulite and fat?
Oh. All right, so cellulite and fat. Fat we have everywhere in our body, right? In all these different places. We have it next to our intestines, we have it around our face, we have it in our thighs. It is normally the thing that allows our skin to glide and move up and down when it's underneath, on top of a muscle or anything like that. Cellulite, I think what we just talked about is like these fibrous attachments that go between the fat up to the skin. And that's the part that causes that dimpling, because when the fat changes, those ligaments still stay there, right? So if the ligaments still stay there, that's what's causing that cellulite of that depression that you see on the outside of the skin, because the volume around the depression has kind of gone away. So it's like creating that crater around the attachment, and that's where the Aveli goes in and removes the attachment. So therefore now everything is on the same timeline.
Yeah, I think you mentioned like a couch cushion or something, a tufted cushion, the little buttons that pull down, the fancy little cushion. That would be like where the band is pulling down, and the fluff in the cushion would be like the fat.
Yeah, great analogy, love it.
Cool. Aisha just asked, is there any tips or tricks to help maintain my results?
Ooh, that's great. Great question. I think nutrition, hydration, right? And then also
SPF.
SPF for sure, skincare, moisturization to all that skin area, like all the self-care things that you would need to, right? Your skin's the biggest organ that you have. So the more you can do to take care of it, this includes what you put in your body and what you put on top of it. So those are the two biggest things that you can do to maintain results for this. Again, the cellulite part's gonna be permanent since we're taking away those dimpled areas. But for skin tightness, it comes down to what are we doing on a daily basis to maintain? And that's all in the skincare regimens.
Awesome. Laura asked, have you ever had to turn anyone away for this treatment? And if so, why?
Oh, great question. And I think that comes back down to our massive weight loss patients, right? And when they're asking for a result that is surgical, but they're saying, hey, it's cellulite, it's the extra skin. And I think that's where we don't want to do procedures that don't give people their ultimate results and the treatment that they're looking for, right? Things that only do partial results, it's just not worth it. And that's where we turn away patients. Essentially, one of the most common reasons is that if it's not going to give them the result that they want, they think that it's some procedure that's going to be a cure-all, and they're like, oh yeah, I want this, and they're pulling half their leg up their thigh, and that's not going to happen with Aveli, right? Aveli and body type are going to be more of a skin tightening that's around that area and removing the dimple, right? It's not going to literally lift up any of the fibrous attachments from the entire leg, from the knee all the way up to the thigh. And so I think those are the major patients that we don't want to recommend these type of procedures, because they're not going to get the results that they're looking for if that's what you want.
Awesome. Gracie asked, does Aveli work equally on all skin types?
Yeah, great question. It is colorblind. It's one of the few things that is colorblind, and being able to address all skin types. Mainly it's the dimple, right? It's the dimple that is treating, that fibrous attachment, and then being able to use the other technology of the radiofrequency microneedling or the body type to combine all the skin tightness with removing any of those fibrous attachments.
Cool. And then our last question that we got is, how can I prevent new cellulite after the treatment?
Yeah, and this is back to that skincare regimen and what we're putting in our bodies, right? We don't want to have large fluctuations in weight, and we don't want to lose any more volume in terms of the things that are around these ligaments that are holding up our bodies and skin and ligaments for different areas. So I think that's probably the biggest thing. Anything that you else have to add?
I would agree. No.
Yeah, I think that it just comes down to all the regimens that are super important. That comes down to mindset, comes down to skincare, also comes down to hydration and diet and nutrition, right? That diet word that people hate, it's not really a diet, but it's a meal plan to get you the right protein intake so your body has all the necessary things. So it's not thinking that it's in winter, right? It's not starving itself, not depositing fat in different areas, not doing things that you don't want to do because you think that, hey, I'm not putting these calories in my body, but you're not really putting any of the calories that you're needing in your body.
And as far as the skin integrity, not even necessarily a calorie deficit, just ensuring that you're getting adequate nutrition as far as protein and macronutrients, micronutrients, all the good stuff.
Yeah, I think one of the common misconceptions is like, I'm calorie cutting. Well, great, but then it's only going to take you so far because you're going to lose a lot of muscle volume versus how much fat's actually going to go. Your body's actually going to try to store as much of the fat as it can because it's thinking winter's here.
Awesome. I think that's all the questions that we have. So.
All right. Well, thanks for tuning in to our dimple-free Aveli and our body type combo procedure, and we look forward to seeing you in the office.